Hello friends, today we're going to talk about zinc and magnesium. Zinc, why you should take it? Zinc is a dietary mineral that's often promoted for boosting testosterone. Has numerous roles in the body, most notably as a catalytic and structural element in hundreds of metalloproteins. Meat, egg, and legume products are common sources. Oysters are particularly good sources of zinc. It's true that taking a zinc supplement can increase testosterone levels, but only in people who have a zinc deficiency. Athletes are more prone to zinc deficiency than the general population because zinc can be lost through sweat. Zinc deficiencies are associated with lower testosterone levels, so if supplementation brings zinc levels back to normal, testosterone levels will rise with it. It is important to note that increasing zinc levels above normal body levels will not increase testosterone any further. High doses of zinc can irritate the gastrointestinal tract and cause liver and kidney damage. Over time, high doses of zinc can result in a copper deficiency. What are zinc's benefits? Any benefits of oral zinc supplements or increased dietary intake will depend on the zinc status of the individual. Some research suggests that when zinc levels are low, insulin sensitivity and testosterone can decrease, and supplementation can bring levels closer to normal. Zinc lozenges, in high doses, seem to reduce the duration of common colds, though it's unclear if they reduce the risk of getting colds in the first place or the severity of the symptoms. Their effects are largely limited to throat and nasal symptoms, and high doses tend to come with some mild but notable side effects, like nausea and metallic taste in the mouth. Other areas of note are depression and acne, which can frequently benefit from increased zinc intake if levels are low. Zinc is lost through sweat, making supplementation very important for athletes that don't get a lot of zinc through food. Insulin resistance can also decrease zinc levels. What are zinc's side effects and drawbacks? Large doses of zinc can produce nausea and other forms of gastrointestinal upset, particularly when taken on an empty stomach. Large doses of zinc can also cause a copper deficiency and lead to overdose. Many supplements use far more than the RDA, and a combination of supplements, fortified foods, and high zinc foods may lead to exceeding the tolerable upper intake level for adults, which is 40 milligrams per day. High-dose zinc lozenges can lead to nausea and a metallic taste in the mouth, and should only be taken for a short time if at all. What problems does a zinc deficiency cause? Zinc deficiency in childhood can impair growth. In adults, zinc deficiency can result in hypogonadism in men, as well as mental lethargy, depression, and skin abnormalities. Low levels of zinc due to diabetes can further worsen insulin resistance. It is estimated that inadequate zinc intake affects around 10% of persons in the US, but global insufficiency rates are over 50%. How to take it? Zinc has two standard dosages. The low dosage is 5 to 10 milligrams, while the high dosage is 25 to 45 milligrams. The low dose works well as a daily preventative, while the high dosage should be taken by anyone at risk for a zinc deficiency. Zinc should be supplemented in the range of 25 to 30 milligrams of elemental zinc per day. Elemental zinc refers to the weight of zinc itself and excludes the weight of the compound it is supplemented with to help absorption. For example, consuming 230 milligrams of zinc gluconate means consuming 30 milligrams of elemental zinc. This dose is commonly recommended for athletic people who have high zinc losses in sweat. If you are either sedentary, don't produce a large amount of sweat, or have a diet moderate to high in meat products, this dose could be dangerous for long-term daily usage. If that's the case, then reduce the daily dose to the range of 10 to 20 milligrams once daily. Zinc should be taken with meals, since some people may experience nausea after supplementing zinc on an empty stomach. Do not pair zinc with minerals. Zinc's intestinal uptake is hindered by other minerals, like calcium, magnesium, and iron, in combined doses of 800 milligrams or more. Combining them at low doses is fine, but in high amounts the minerals will compete for absorption and limit the overall effectiveness of supplementation. Zinc is a form of essential mineral and immune booster. Its primary function is for general health. It has other functions, such as antioxidant, anti-inflammatory, allergies, and immunity, and goes well with green tea, increases absorption. Magnesium. Why should you take it? Magnesium is a dietary mineral, like zinc, and the second most prevalent electrolyte in the human body. Magnesium deficiencies are associated with lowered testosterone levels, is common in developed countries, and is often caused by diabetes and other conditions. A lack of magnesium will raise blood pressure and reduce insulin sensitivity. Supplementing magnesium when deficient in magnesium will restore testosterone levels to normal. People without a magnesium deficiency should not supplement magnesium, as it will not raise testosterone levels above normal. Like zinc, magnesium is lost through sweat, so it is often recommended for athletes. Magnesium deficiencies are common in the Western diet because grains are poor sources of magnesium. Other prominent sources of magnesium, like nuts and leafy vegetables, are not eaten as often. It is possible to fix a magnesium deficiency through dietary changes. If magnesium is supplemented to attenuate a deficiency, it acts as a sedative, reducing blood pressure and improving insulin sensitivity. Maintaining healthy magnesium levels is also associated with a protective effect against depression and attention deficit hyperactivity disorder, ADHD. Supplementation of magnesium is not very effective at reducing fat mass or cramps. Further evidence is needed to determine if magnesium supplementation can boost exercise performance, but initial results do not look promising. The intestinal absorption of magnesium varies depending on how much magnesium the body needs, so there are not very many side effects associated with supplementation. If there's too much magnesium, the body will only absorb as much as it needs. However, excessive doses may cause gastrointestinal distress and diarrhea. How to take it? The standard dose for magnesium is 200 milligrams of elemental magnesium, though doses of up to 400 milligrams can be used. Elemental magnesium content is found on the supplement label. It is the amount of magnesium in the supplement, excluding other compounds that may be included. Magnesium can be supplemented through magnesium citrate, magnesium diglycinate, and magnesium gluconate. Magnesium oxide is not recommended for supplementation because it is poorly absorbed and is more likely to cause intestinal discomfort and diarrhea. Magnesium gluconate should be taken with a meal to increase the absorption of the supplement, but other forms of magnesium can be taken, either with food or on an empty stomach. Magnesium is a form of stress relief and essential mineral. Its primary function is for general health. It has other functions, such as insulin sensitivity, cardiovascular, testosterone boosting, and goes well with vitamin D. I hope you enjoy the video. We'll be back with more content. Goodbye.